Rhiannon, in your experience, what preventative measures truly make the biggest difference when it comes to employee mental health?
The evidence on workplace mental health is that prevention works best when an organisation is proactive with their measures and not just reactive to kind of those individual support needs. It's preventative measures are key and focusing on that. And, let's just think about the factors that can add to stress. We've touched upon it today, but we know that factors like excessive workload, that lack of control, poor role clarity, job insecurity, insufficient support. Now, these don't just worsen existing mental health problems, they can actually actively contribute to the development of things like anxiety, depression, and burnout. So, preventative action starts here. And evidence shows that if you increase employees' sense of control over how and when they complete their work, this has a real kind of protective effect on mental health. The big one for me, and it's been a theme throughout our discussion here, is psychological safety. And it's so important. It's one of the strongest predictors of that positive mental health at work. So what does this actually mean in the work environment? So it's creating that safe space that employees feel comfortable to be able to disclose how they're feeling, to share their worries, to set boundaries as well without that fear that it's going to be judged negatively or there'll be kind of a negative consequence to it. So we can see, mental health in the workplace, it's not a nice to have, an optional add-on, wellbeing add-on. It's so important. These preventative measures are key here. And I do think the same principles apply as physical safety at work. So with mental health, we should be identifying the risks, trying to reduce the exposure to the stressors, and always monitor and evaluate the impact of our preventative measures with our staff.